¿Cómo estás, mamá? ¿Bien?
Muy bien.
Señor, what's up? ¿Cómo anda?
Bien.
For single mom Carmen Escobar and her children Lupe and Leo, a trip to the Healthcare Network's Children's Care Office in Golden Gate City is more than just a health checkup. Leo gets regular treatments for a chronic joint illness that, without the persistence of Dr. Jorge Camina, would have likely gone undiagnosed. But like the more than 40,000 Collier County residents a year who visit the network's physicians, this family will receive not only state-of-the-art primary care from Dr. Camina and his staff, but access to other needed services as well.
I think the biggest help that we've been to Mom, if anything, has been just being there. The mom has other issues on top of Leo, social issues that affect her daily life. Not that we solve it, but we point her in the right directions. We give her some of the resources that we can, whatever little we can help, and we get the job done.
El doctor, como profesional, se desenvuelve en su rama y aparte de lo que él es como el pediatra de mi niño de cabecera, a veces vengo a pedirle consejos como padre, aparte de lo que él es el médico, porque soy madre soltera y a veces vengo a pedirle orientación por mi niña, por mi niño, y gracias a él siempre cuento en algo que vengo a comunicarle o...
Since its founding by community leaders more than 35 years ago, the Healthcare Network has evolved into an organization that embraces the concept of a patient-centered medical home, an integration of biological, psychological, and social sciences aimed at both prevention and treatment of illness. Simultaneously, the organization has grown from one small Immokalee operation to 12 offices spread throughout Collier County, plus the Ronald McDonald Caremobile to treat patients from all walks of life, both insured and uninsured.
Well, originally the patient population that we cared for was the migrant farm workers in Immokalee. And when I came there in 1980, that was almost exclusively all that we cared for. Over the years, there's been a natural progression to expand our targeted population to really treat anyone and everyone who has an access issue. So we're talking about a lot of care that we provide that if we didn't, those folks would either go untreated in some cases and their problems would just become chronic and compounded, or more likely a lot of them would end up in the emergency rooms of the hospitals.
Of the more than 40,000 patients a year served by Healthcare Network, more than 30,000 of them are children. It's the largest of the network's 4 main service areas: children's care, family care, women's care, and dental care. Dental care is a good example of how Healthcare Network provides not only needed medical care to underserved populations, but also how that care impacts the community as a whole. For example, educators have long observed that children without adequate dental care have higher absenteeism rates and problems concentrating on their studies. Healthcare Network approaches this issue in several innovative ways. First, 2 state-of-the-art dental centers, one in Immokalee and the other in East Naples, provide care in locations convenient to the often transportation-challenged patient population. Second, an innovative partnership with the University of Florida's Dental School on the Edison State College campus in Naples provides additional manpower, cutting-edge dental technologies, and a mutually beneficial educational experience for our community. And third, yet another innovative partnership with Ronald McDonald House Charities of Southwest Florida has resulted in the establishment of the Caremobile program. Because of generous support from the Southwest Florida community, this 40-foot-long, 8-foot-wide, state-of-the-art medical clinic travels to schools, community centers, and residential neighborhoods to deliver primary dental, vision, and medical care to area residents like Norma Ocañas and her granddaughter. For Ariana, this visit provided vital follow-up dental work from the Caremobile dental team. It's important to note that while Ronald McDonald House Charities provided the vehicle, grants and donations are needed to cover the day-to-day operation of the program.
The funds that come to the Caremobile especially Most of them are to provide dental services and vision services to the children in the community that would not get glasses or dental care otherwise. And it's a big, important need for these school-age children to be able to learn and to succeed.
Strategic partnerships with these organizations, local hospitals, and other private medical care providers allow the nonprofit healthcare network to maximize the services it can offer while minimizing the costs of providing those services. The partnerships also keep Healthcare Network at the leading edge of medical care. For example, 3rd and 4th year medical students from Florida State University's medical school work with network physicians in Immokalee to provide women and children the very latest in healthcare treatment.
For Collier County, it's huge. They are actually the patients here have cutting-edge treatment by coming to this facility. On a national level, we are emphasizing primary care, patient-centered medical homes. We're emphasizing behavioral health that's embedded within primary care, and all our patients have all of that.
Beyond the partnerships, the state-of-the-art electronic record keeping, the modern facilities, the innovative treatment methods, you'll find what is perhaps the most important ingredient in the success of the healthcare network of Southwest Florida: a medical staff that truly cares about its mission and the patients they serve. Dr. Jose Cuero left private practice about 20 years ago to treat patients here and is now chief of adult medicine. Angela Martinez first came here as a patient, and now she's a nurse in one of the clinics. Likewise, Tony Rosales first visited as a pediatric patient while his family was working in Immokalee Fields as seasonal farm workers. He's now the office manager for the Immokalee Dental Clinic, and his mom, Christina, is a patient service representative. Another former migrant worker, Andy Gutierrez, is now the program coordinator for the Ronald McDonald CareMobile.
Having a migrant background myself, it definitely more than a job. I'm very passionate about it, and if you don't have that mindset, it would be tough to do this day in and day out, because there's so many people that need the help, and you have to try to help as many as you can in the time that you have.
It's all about passion and love. Everybody that works here, the doctors, the assistants, the receptionists, they all try to have the utmost customer service.
Because we really do take interest in the patients personally. A lot of them already know us by first names, and when they call, they ask for a specific nurse, and that's who they want to talk to because that's who they feel comfortable with.
It is not only just coming in and seeing the physician and getting diagnosed correctly and then given the appropriate medications, which is what most doctors are expected to do. We have to go beyond that, in that we have to make sure that the individual has the resources to obtain their medications to treat their conditions. We have to make sure that they get the appropriate laboratory tests and analyses done or get them to the appropriate place.
Healthcare Network is supported by a combination of patient fees and reimbursements, federal grants, and generous philanthropic support from local individuals and organizations. Audited results show fully 96% of the budget goes directly to patient care. Since 1977, various members of the local community have volunteered their time to promote the mission of the Healthcare Network, which is to provide a quality healthcare home accessible to everyone. In 2007, some of these same volunteers formed the Healthcare Network Foundation.
Take a look at this organization and see how this organization has helped this community and the people of this community, people who are in need, the children of this community, for 30+ years. And this is something that should be on the top of everyone's agenda who believes in helping people in this community.
Come with me out to Immokalee to see all of the facilities there. Spend a day shadowing the CareMobile to see the smiles on the faces of the kids as they come on, the wonderful care that they're getting. I would say come to meet some of the professionals, our doctors and the nurses and the PCs and the people that work, the administrators, to see how committed they are. And once you could see that, then you'd know that this is a worthwhile organization, and you'd want to give your time and your treasure and your talent to it to support it.
Visit our facilities and chances are you'll meet someone like high school student Nyla Gutierrez, who, with the help of Dr. Kamina and other Healthcare Network professionals, beat back the childhood obesity epidemic sweeping our country and lost 50 pounds, and is now helping other members of her family lead healthier lives as well.
If you really believe that a healthy society is important, if you really believe that healthy children are important, we're the ones that see the most of them, and any help that we can get is going to help us provide better services for the future of our society.